Hi everybody, I'm Rachel Greenough and I didn't have a job title on the agenda, so I'm the project coordinator for CDOP and also for the partnership, but I'm not here to talk about that today. So I'm going to do an introduction to child death review panels for you. They are a formal mandate, they are a statutory function and they're legally mandated. And they analyse causes and factors contributing to child deaths, and they have a statutory basis importance, as I said. So this is just the structure. I'm not going to go through all this, but the box that I've got round the area in purple there are the areas that Child Death Review Overview Panel is responsible for. So we sit under the Children's Safeguarding Partnership. There are members of the Executive Board that sit, and we also have the Safe Asleep Board and also the Child Death Overview. So this is the guidance that we use. There are links to those. Oh gosh, it's going a bit fast, and you can go back and look at those, and obviously I've got the link to Working Together, which also has the chapter 6 about child death review in there as well. And we can move on now. So this is your Sheffield team. So the confusing part is that there's two Rachels in our team. I'm Rachel Greenoff, and then we've got Rob Fizackley, who you probably spoke to, has been with us for a while. It's jumping very, very quickly, isn't it? And you can get all of us on that CDOP email. So if you're not sure who you want, if you'd send it to that, you can get all of us. Our chair is Eleanor Rutter, who's the Assistant Director of Public Health. And we've got a designated doctor who was Lilith Allison and is now Ranjana Dar. So that's the basic admin team. But we have a lot of people on our panel who I'm going to go into in a little while. Okay, can move on. So our Sheffield CDOP panel meet at least quarterly, sometimes more, it's usually 6 times a year, and we discuss individualised children on an anonymised basis, so all the actual names and stuff are redacted. Then we have a South Yorkshire CDOP, although I'm not allowed to call it that, it's getting a new name, yet to be decided, it's a bit like Prince, and they meet on a quarterly basis, and they discuss thematic issues, so that's Barnsley, Rotherham and Doncaster. And then the last one is a regional CDOP meeting, and that meets quarterly, and I also attend this, and we discuss any issues in the child death review process, and that's really useful because it's nice to get how other areas do things as well. Okay, can move on. So they are structured meetings, and we go through them in a certain way. So we have a collaborative case analysis, and professionals from the multiple sectors work together to examine the cases comprehensively. And we have different people from different multidisciplinaries. So here they are. We have health care professionals. So we have doctors and nurses, some of who are here today. Right, is that what's happening? So we can move one more slide on, please. We also have a legal team there as well. We have a designated nurse from the ICB, that's Nikki herself, and we have a safeguarding GP. And we have some teams from legal, we have police officers there, members from the local authority and education and public health, and we have a lay representative. That's not the same in all areas, so that we're really useful to have that. So this is the actual process chart, and this is in the machine. So CDOP comes right at the bottom when the picture comes back up. Back one slide if we can. So the child death review meeting is right at the bottom. So that when the child dies, lots of things kick in. So there's an immediate decision making and notifications that go out, and we usually get notified by usually a health member, but it can be a police officer, it can be Joe Public down the road as well. And I'm going to go into this in more depth, so you will get this. Whilst all the processes are going on, there is also support for the parents as well through a key worker, and we're lucky enough in Sheffield to have what we call a JAR nurse and a bereavement nurse, so depending on whether the death was unexpected or expected, we've got those as well. The part after the child death review meeting focuses on the local or national learning, and that gets fed into the National Child Mortality Database, who provide learning, but we also have local learning as well. So the core objectives and functions of CDOP are as follows. So as I say, we systematically do it. We have a consistent way of data collecting, and we also inform prevention efforts as well. So that happens right from the beginning. For example, in Barnsley a couple of years ago, people were selling mattresses that were very bad, and that obviously couldn't wait till it got to CDOP. So nationally, that function will come out straight away. Next slide, please. And we look for any patterns, trends, and modifiable factors. So we look for recurring issues. For example, the asthma sprays, they took the counters off those a couple of years ago. Whilst we've not had any deaths of those in Sheffield, that was in certain areas, and that was not picked up straight away. So CDOP really focuses on areas like that. Any modifiable factors, anything that can be changed as well to reduce future risks and prevent outcomes. And reducing similar deaths. So looking at, obviously this child has died, we can't change that, but we can prevent future deaths coming through and improve safety as well. So we make recommendations to prevent future deaths. So we'll make local practical recommendations, which usually have been put into place at the early meetings, but obviously we follow that up with CDOP to make sure that's happening. We improve policies as well, and we can enhance community practices by passing information out and giving recommendations. So the process works as follows. So we have the formal case referral through ECDOP, then we gather the data and we get a complete picture. So this is ECDOP coming up now. Next slide, please. So this is what you'll see, and as I say, Joe Public in the street can fill one of these forms, and you don't have to have a CDOP account to fill in a form. But it's a statutory requirement to notify CDOPs of all child deaths from birth till the 18th birthday. And at the minute, we review children who are usually resident in this area. So, for example, if a child dies in Cornwall, but they're a Sheffield resident, we would review them here. If they are a Sheffield resident that dies in Cornwall, we would review them here. If they're a Cornwall resident that dies in Sheffield, Cornwall would review them. However, that is about to change. For example, I've just been telling the ladies at the front, the Manchester bombing children are all going to get reviewed by Manchester, Greater Manchester, because obviously the learning is for the arena and the area there rather than the areas that they lived in. If there's a number of agencies involved, liaison can take place to agree which agency will submit the notification. But if you submit one as a GP and also a police officer submits one, don't worry, we'd rather have the notification than not have one at all. We'd rather get 2 or 3 in. So you can press that green button at the bottom there. So this is what a notification form looks like, and I'm not going to go through all that detail there, but there's sort of questions that ask you. What I will say is the red questions, the red starred questions are mandatory, so the form will not submit till you've got those, and the little submit button is the green button at the top there. Okay, so if you don't know the answer to a question, that's fine, just put not known, but please do fill them in. So that's the form A, we call that one. And the purposes of that form help us gather information quickly, review the death more comprehensively. You cannot put down enough. So a well-completed form will help you save time and will stop us having to come back to you. Okay? And then the next steps are the hospital decide on what meetings are needed. For example, a joint agency response meeting, which is often known as a JAR meeting. That's usually police and health who go to that. A PMRT for a perinatal death. That may have already been decided if the death was expected. And then an EMA, which is an early multi-agency meeting where early learning comes out. That's a very medically based one, but I attend that meeting as well. And you may get asked as a GP to attend that meeting. And at the same time, a key worker is decided. Usually that is Amy Harris, if you've heard of Amy Harris or Nicola Harting. But if it's, for example, a road traffic death, it may well be a police officer who takes on that role. So once we've got the notification form, we send out a notification form request email to relevant parties, and we ask for a quick response. So we've got a single point of contact in sort of all areas. So Nikki is the one for the GPs, and she identifies which surgery the people who are in that family go to. And then the electronic form B gets sent out to those identified to fill in. If you've never filled one in before, we'll also send you a joining up email then. So that could be hospital staff, schools, GPs, etc. And then we collate those reporting forms. Now, I say that like it's really, really easy. This is the hard part, because people say, oh, well, I didn't know that baby. They never came to our surgery. It may not be the baby. It may be the mum. Or it may be the dad, and it may well be that there's something in that parent's history that is relevant to the CDOP. And as all my other colleagues have been saying today, until we get all those pieces of the jigsaw, that piece of evidence might seem really irrelevant, but it often isn't. And it is a statutory requirement that you comply with such requests as well. So you can't choose not to fill the form in. So you will get nagging emails from us if you haven't filled those in. So if you take anything away from this, please fill those forms in and please contact us if you're not sure. Next slide, please. So then when it gets to the child death review meeting, that happens after all the other meetings have happened, after any criminal investigations have happened, etc., etc. Then we start to fill in one of the forms that you can see on the left there, and that checks about different domains. So factors intrinsic to the child's health history and medical conditions is really important that you would want to know about. We also look at factors in social environment, including family and parenting. So we are interested in the parents. So coming back to that baby who died in hospital, we are interested in any conditions that mum and dad have got. Factors in the physical environment and factors in service provision as well. And as I say, it can take months. It can take years if there's police investigations running concurrent, and we cannot bring it to CDOP until all those things have happened. However, your information is really important for the earlier meetings, so please get those in. It's a draft analysis form. We look for any modifiable factors and any room for improvement. Okay, next slide, please. And we respect family privacy. So CDOP don't actually deal directly with family themselves. That's already been dealt with by the key worker. And they actually bring some information for us. So we will get the information, but we don't deal with parents. So we have the anonymised secondary review. We go through them, that draft analysis form that you just saw. And we analyse the information to confirm that that's all correct. And then we notify the Child Safeguarding Practice Review Panel and local safeguarding when it's suspected if a child's been abused or neglected. That can happen, ideally at the beginning, but it can even happen at CDOP if we'd not decided by then. Okay, next slide, please. And so some of the impacts on CDOP on policy and practice. So it informs local strategies, as I've said. It could provide crucial information. And it can help address risks. So it drives improvements in safeguarding and healthcare. So on the next slide. Okay, so it helps provide training, it helps improve safeguarding protocols, and it enhances healthcare services as well. Okay, so we notify the medical examiner and the doctor who certify the cause of death at the beginning. We provide specified data to the National Child Mortality Database. We do an annual report, which I'm in the process of writing. We've got the local one, but we write a South Yorkshire one as well, and contribute to any local and regional national initiatives. So next slide, please. So here are some recent reports. As you can see, child mortality during winter periods has very recently come out. NCMD falls from windows, and you can look at those yourself. On the right there is the new When a Child Dies guide for parents and carers that any bereaved parents will get. So we raise public awareness. So, for example, very recently there's a link to a BBC article that was about 13 child deaths as a fall from windows. You may remember there was a child who died from falling out of a hotel a couple of years ago in Sheffield. So they're mentioned in that report. And community involvement. So we work with organisations such as Fairvale Hub to give them information as well. We also have Sitting Under as the Safe Asleep, who meet every 2 months, and we've recently looked at the training offer, and we give out the information from the Lullaby Trust there as well, so the link to them is there. And Infant Mortality Group. There's a new strategy just about to launch, and we've got a new project coming out called Connect to Beginnings as well, which is using some of the data that we've discovered why people are dying, why babies are dying in CDOP. So this is for your under ones, that is being used to do local public areas. So what can GPs do? We've all hopefully been sent this. If you haven't, here it is. It's a 7-minute guide to what you've just heard. Please refer to this. There's some links in the box 6 there to help you as well. Okay, so it's a thorough review process. It's a multidisciplinary collaboration, and it informs policy and practice. And as my other colleagues have said, I'll be around for the rest of the state. So if you want to ask any questions, you can come back to me at break time.